there guys, Alex from Mental Health Thinking here, and I've got another video for you today. This one's on generalized anxiety disorder. So I'm going to talk about what it is, the cycles that lead to it, and as usual, what you can do to cut those cycles off. Also give you an impression of when it might be a good idea to talk to somebody about it. Generalized anxiety disorder is characterized by somebody who worries a great deal. Now, I described it a little bit in my last video, but in case you haven't seen it, worry is thinking about future things that might go wrong, and usually in a cyclic way, so you keep on thinking about it for a long time. That kind of worry makes us feel anxious and actually can, if we're doing it a lot, create a lot of the side effects that I'll talk about next. You can have problems with your sleep as a result because you worry at nighttime. You can have problems with your concentration because you can't focus on other things as well. You might become fatigued over the course of a day because it's really difficult to get through when you've got so much going on, so much that's keeping you in a high arousal level. It's hard on your body. You can become restless or irritable with people because your cognitive resources are really quite low, and can even, due to the anxiety, get clenched up and have a lot of muscle tension throughout the day, causing more fatigue and problems down the line, because they're the types of things that we do when we're in a high stress mode. So if you go back to my video on diaphragmatic breathing, I talk about what happens when you're in a high stress mode for a lot of your life. People who have a lot of worries, a lot of concerns in this way, can end up being in a high stress mode and actually increase their chances of cardiac problems down the line. Now, there are two main beliefs about worry that, as a psychologist, a provisional psychologist in my case, we would look at in people so that we can address these concerns. One is the positive side of it. It is the idea that the worry is good in a way. Now, it's because worry can be considered indistinct in a way from proactive and productive thinking. So thinking about things that might happen in the future just for the purpose of determining better ways to actually act in the future. Now, this is something that most people do from time to time, and it can actually help us to prepare better. It's when we start getting caught up and doing it too often, and we lead into what I really just think of as pure worry, which is thinking about things about which we really don't have control. So thinking about things that upset us that may happen in the future when there's nothing in particular we can really do about it. To address that in therapy, what we do is come up with worry time. Now, I usually refer to it as proactive, productive thinking time, something like that, because that's what you're doing during that time. It's the actual useful side of what goes into the box of worry. So you might schedule out half an hour a day if you really need a lot of time. It might be 10 minutes a day, but it's a certain amount of time that you decide that's my task, that's what I'm doing during that time, is I'm just allowing myself to have that thought about things that might go wrong in the future, but it's with the idea of preparation. Once that task is complete, for the rest of the day, you don't want to be thinking about anything else to do with worry. Now, once you've sorted that out, you can go to my video on mindfulness, and you can actually use that to help you to decrease the worry, because it increases your ability to switch attention and shows you how you can decidedly think about what you want to rather than what you don't. Now, there are also negative beliefs about worry. So the idea that if they worry too much, if it gets out of hand one day, then they might go crazy, they might lose it, or they might pass out, or they might have a heart attack and die. So these are often things that people who have a great deal of worry, to the point of clinical concern, that they think about and take really seriously. I do recommend that if you're having those sorts of thoughts, that you really can't control your worry, and that if it gets out of hand then something terrible might happen, that's a really good indicator for me to say, go to your GP, get a referral, and go and see a psychologist. In therapy, you can look at that side of things by experimentation. So come up with your therapist perhaps, some ways that you can test the particular ideas that you have that may happen with your worry, so that you can be more realistic about what's actually going on, what's going to happen. The idea, and it's generally really quite effective, is once that's treated, the hypervigilance of really spotting out that emotional concern about the thoughts you have about worry really dissipate a great deal, because there isn't that holding factor, that concern that if you worry too much, the thoughts themselves can be dangerous. Okay, so that's my talk on generalized anxiety disorder. The takeaway message is that anxiety generally comes from, at least in the context of generalized anxiety disorder, worrying a great deal, thinking about things in the future that might go wrong. This can cause a number of symptoms and usually becomes really significant when there's an idea that you don't have control over your actual thinking, over the worry that you have. There's usually two sides of the coin in terms of positive beliefs about your worry, that it can help you prepare for the future, and negative beliefs about your worry, that if you worry too much, something terrible might happen. So these are all indicators of generalized anxiety disorder, but realize that unless you're getting to the point where it's really highly impairing in your life and you're having a lot of the other symptoms to do with anxiety, like the problems with concentration, your sleep, your restlessness, muscle fatigue, etc., then you're looking at something that's not to worry about. Something that is within the normal range, because worry is something that we all do. Okay, so if you like this video, hit the like button down there so that other people can see it. And if you want to see more, I'll be making them every week. Hit the subscribe button. Thanks.